Hey there, are you scared of high cholesterol? Are you someone that's taking a lipid lowering drug like a statin? Guys, my name is Amanda Brooks. I'm a practicing physician assistant. I've been practicing emergency medicine for 20 years, and it's really my hope by hopping on here today that I can help educate you, open your eyes, and maybe help you to look at things a little bit differently. So after my video last week announcing that I have been adhering to a carnivore diet for 2 months and feel amazing, many of you have reached out and wondered if I'm concerned about my cholesterol. So I thought, using my knowledge, I do have a Bachelor of Science in Human Nutrition, and I have the ability to be open and look at research, new and old. So what I did is I went back to the basics, and I wanted to remind myself and help educate all of you as to how important cholesterol absolutely is to our bodies. Guys, our body makes 80% of our cholesterol, okay? Only 20% of it comes from our diet. Now, this is important because with our over 30 trillion cells, every single one of those cells has a cell membrane, and 30% of that cell membrane is made up of, yeah, you guessed it, cholesterol. Okay, so that's important. Now, cholesterol is used to repair arteries. So when damage occurs in our bodies, cholesterol is a vital nutrient to help repair. It is a huge component of 5 hormones that I think all of you are very familiar with: testosterone, estradiol, progesterone, aldosterone, and cortisol. So without cholesterol, we wouldn't be able to make these hormones, okay? It's also the basic building block for vitamin D. We know that cholesterol also plays an important role in making bile. Bile is actually made in the liver, it's stored in the gallbladder, and its job is when we consume fats, it's released by the gallbladder, helps to emulsify that fat. And if this cholesterol was something that our body just really didn't want, we think that it would probably be expelled in our waste, right? Did you see my video last week on fiber? If you didn't, please check it out, because our body doesn't have the ability to absorb fiber. So we poop that out. But cholesterol, we actually reabsorb. And without bile and cholesterol, we wouldn't be able to absorb fat-soluble vitamins, your A, D, E, and K. So what I'm trying to portray here is, I know that we look at cholesterol or high cholesterol oftentimes as a villain, but I'm wondering if we should, because cholesterol plays a vital role in our body and how we function. So thanks to Dr. Ken Berry and Dr. Diamond, I did recently review some other studies looking specifically at high cholesterol. Now, when we're talking about cholesterol, guys, we're usually looking at 3 numbers, right? Like, we're looking at triglycerides, which are a direct representation of one's diet. So if you have high triglycerides, we know that you're probably consuming a diet very high in carbohydrates. So if you're a sugar monster, or if you're a pasta lover, then these are going to be high. The other component that we look at is HDL. This is your good cholesterol. And then we look at your LDL, okay? So there's actually studies that show that there is actually no link to premature death and elevated LDL. Actually, there's a study looking specifically at individuals who have higher levels of LDL. They actually, or higher levels of cholesterol in general, they actually live longer lives. They die, they are less likely to die prematurely from cancer, from infections, and they actually have a normal rate of cardiovascular disease. So if one starts to adhere to a carnivore diet, so if they're consuming large amounts of animal products, they've also increased their fat consumption while decreasing their carbohydrate consumption, right? So if one is adhering to a diet like this, what's going to happen? Well, triglycerides are going to be low because of the carbohydrate consumption being zero or close to zero. HDL level is probably going to be quite high, and the LDL level, it could be through the roof. Okay, so if you're adhering to this diet and you go and you have your cholesterol checked and your primary doctor looks at your numbers, they could think that you have familial hypercholesterolemia. That's hard to say. There's a certain subset of the population that actually creates more cholesterol, and they supposedly have a predisposition, have a higher risk of developing heart disease. That's what I was taught in school. Now I'm questioning all of that. Like I said, cholesterol has a very important role in our body. And just because someone's producing a large amount of cholesterol doesn't mean that's necessarily bad. You know what the factors that we don't talk about a lot? You know what really influences how cholesterol affects our body is our fasting insulin levels, our glucose levels, okay? These are all things that we need to take into consideration. There has not been a single paper that I'm aware of that shows that people die prematurely with an elevated LDL level, okay? LDL, it actually helps the immune system function. Like I said, those that have the higher levels of LDL, they're living longer. They have a less chance of developing cancer, developing infections. This is all really important, and I hope that you guys are writing this down. Okay, so when you're coming into the emergency department, right, a knee-jerk question for me to always ask is, what's your cholesterol? Are you taking lipid-lowering drugs? Probably 80% of the people that I see over the age of 50 are on a statin. A statin drug, we won't spend this video talking about them, but they're designed to decrease LDL. So why are physicians continuing to prescribe these drugs, right, when I tell you that studies show that individuals' all-cause mortality does not decrease when their LDL levels are high? Now, something that you've probably never heard about, or very few of you have heard about, is the coronary artery calcium score. So we know that this is a direct predictor of possible progression of coronary artery disease. So this is a much better thing to follow if you're concerned about coronary artery disease. Now, we don't use this much in the ER. I don't read much about this. I'm kind of thinking, don't know, but maybe that's because there isn't a drug that lowers the coronary, the calcium artery score. So if we're looking at the coronary artery calcium score, ideally we want it to be 0, but it's something that you trend. So if your coronary artery calcium is elevated, we'll continue to trend. So obviously that could trend down as well. You could make some lifestyle changes, some diet modifications, but the coronary artery calcium is completely independent of the LDL. So we can look at studies of individuals that have known coronary artery disease, that have super high LDL and high coronary artery calcium scores, and then we can look at individuals again that have high LDL that don't have coronary artery disease. So again, I hope I said that right. Doing these videos and not knowing technology, so I can't go back and look at what I said, but let me just reiterate that. So coronary artery calcium is completely independent of LDL. Okay, so we can look at studies with individuals that have elevated LDLs and low coronary artery calcium scores and high ones. So those with the high coronary artery calcium scores, greater than, 200, 250, they have a greater risk for MI, for heart attack. All right, does that make sense? So the LDL, which we're hanging our hats on in modern medicine so much of the time, is not a direct predictor of heart attack, whereas the coronary artery calcium is. Again, what really matters, guys, is your blood glucose. So I'm seeing patients left and right that aren't aware that they're pre-diabetic. I'm looking at their glucose levels, I'm making them aware, and they are absolutely flabbergasted. They're shocked. So those that have higher blood sugar levels, those that are diabetic, have a higher risk for heart attack. Now, someone asked me, if I'm adhering to this carnivore diet, if I'm eating no carbohydrates, if I'm eating more animal products, and I have a high HDL, so a high good cholesterol, my triglycerides are super, they're spot on, impeccable, but my LDL is through the roof. Is there a threshold? Like, is there a number I need to be looking at? No. No, there isn't, actually. So there's not a number that you need to be concerned about. Not to throw Dr. Barry under the bus or anything, but I heard the other day in an interview that he did with Dr. Diamond that his is 250. So his LDL is 250. Not broadcasting that, but he broadcasted it himself. So again, LDL itself does not predict heart disease. So there is something else that I want to bring to your attention, and this is something that I just learned about after reading some research that was presented by Dr. Diamond. There's a certain subset of individuals that have a genetic anomaly that activates the clotting cascade. If I pulled this up on here, we would see this major, intricate clotting cascade. And when we activate, if we activate this clotting cascade, like if we activate the PT, fibrinogen, factor VIII, this is going to make our blood a lot more viscous, a lot stickier, a lot more likely to form clots. So there's a certain subset of individuals that have known familial hypercholesteremia, so people that naturally produce more cholesterol that have this anomaly. So this pathway is turned on. Now, if you're more likely to form clots, you're going to be more likely to have a heart attack, because that's going to cause decreased blood flow to the myocardium, which is the heart muscle, right? Causing cell death, causing a heart attack. Same thing with stroke. So what turns this pathway on is stress, high blood pressure, another thing that we should focus more on, and elevated glucose levels, okay? So stress, high blood pressure, high glucose levels activates our clotting system. Now, where did this come from? Like, when we look at our ancestors, like, this was really kind of cool. And the reason why is because when they were in fight or flight, like when they got into a stressful situation, they're trying to outrun a lion or a bear because they were fearful for their life, they activated the stress response, which increased the clotting system, because if they got clot or if they got hit, if they got taken down, they didn't want to bleed out, okay? So that's cool for back then. But now, very rarely are we going to get annihilated by another animal or even another human. And so if we are under a lot of stress and we're activating that clotting system, we are at higher risk for heart attack and for stroke. So I did talk about meditation, how important this is. If you didn't see that video, please check that out, because stress management and blood pressure control is very important. And these are factors that we ourselves can actually control. So interesting in bringing this up, because instead of just a knee jerk being put on a statin drug, it might behoove you to even have some of these clotting factors tested and be started on a blood thinner of sorts. So again, is LDL always innocent? Okay, if we're looking at an individual who's adhering to, a carnivore diet, again, if their HDL is high, their triglycerides are low, and they're like worried about their LDL, most likely their LDL is large, buoyant LDL. It's not something to be concerned about. But if you are adhering to the standard American diet, guys, and your triglycerides are high, and your HDL is low, and your LDL is high, that's probably like the small, dense LDL, and that's not great for your health. So if you have a big waist circumference, if your blood pressure is high, if your glucose is high, these are all other factors that we have to take into consideration. I'm doing this video to hopefully enlighten you, to make you ask some questions, to revisit your stance on cholesterol, and maybe even rethink about adhering to a carnivore diet where you're eating more, beef, bacon, butter, eggs. Yeah. So I hope that you found this helpful. I will put those studies in the show notes below. Again, I'm learning with you. I'm trying to educate you. I'm trying to help all of us be the best that we can be. And yeah, be well, take care, and chat soon.